The Registered Nurses Association of Ontario, commonly known as RNAO, is a member-driven professional body that has represented registered nurses, nurse practitioners, and nursing students for almost 100 years. With more than 51,650 members strong, RNAO has made a name for itself by speaking out for nursing and speaking out for health. RNAO's International Affairs and Best Practice Guidelines Center delivers programs and services dedicated to the professional development of nurses and healthcare organizations. We inform and support clinical practices through our Best Practice Guidelines, or BPG program. We've published 50 BPGs and many other resources to help healthcare organizations implement evidence-based care. Our network of Best Practice Spotlight Organizations, or BPSOs, are health service and academic organizations that commit to implementing and sustaining the BPGs they adopt. The program's success is measured by the 1,500 BPSOs from across Ontario and around the world who are improving health outcomes for their patients. Nurses are passionate advocates for healthy public policy. Nursing practice is evidence-based and informed by a deep understanding of the social and environmental determinants of health. RNAO and nurses know the path to a healthier Ontario requires action on a broad range of issues, from nursing and healthcare delivery to the climate crisis, housing, and poverty. We envision a health system that is accessible, integrated, equitable, person-centered, publicly funded, and not-for-profit. Engaging Ontario's nursing workforce is critical to this vision. Nurses in Ontario are grouped into 3 classifications: Registered Practical Nurses, or RPNs, RNs, and NPs. Each classification is rooted in formal education and entry to practice licensing requirements. In Ontario, RPNs must earn a 2-year diploma in practical nursing. RNs require a Bachelor of Science in Nursing degree or a Bachelor of Nursing degree. NPs need a master's degree and NP certificate. Nurses can also advance their education to pursue different nursing designations, often called bridging, to new roles. For example, RPNs who wish to expand their scope of clinical practice may choose to bridge to an RN role, and personal support workers can bridge to nursing roles through continuing education and licensing. Members of the public typically associate nurses with clinical roles. These are roles where care is provided to patients, clients, and/or residents in a healthcare setting, including primary care and community clinics, shelters, correctional facilities, and more. Attaining a nursing specialty certification is a way that practicing nurses can continue their education and engage in professional development. Some nurses in clinical roles choose to get a master's degree to allow them to serve in advanced practice nursing or clinical nurse specialist roles. Many nurses also pursue doctoral education. This could be a PhD, a Doctorate of Nursing, or DN, a Doctorate of Nursing Practice, or DNP, or a graduate degree in a related discipline. While most nurses who have obtained master's degrees or doctorates stay in clinical nursing roles, a growing number work in education, research, policy, and management. Expertise and leadership is critical across all areas of nursing practice. Nurse leaders serve as an important voice for the profession within healthcare settings. They direct attention to the social and environmental determinants of health. They inspire evidence-based practice and improved health outcomes. Nurse leaders also shape healthy work environments, transform health policies, and advance health systems. High-quality nursing education is crucial for nursing and for health. The next generation of nurses need an adequate and steady supply of educators to train and prepare them for work in varied settings. Regardless of their setting and role, nurses draw on their education and the experience they gain throughout their career to provide expert care and health services to individuals, communities, and the system as a whole. Extensive research shows that RN care is associated with better patient and clinical outcomes, nurse and organizational outcomes, and financial outcomes. There's a direct relationship between a healthy nursing workforce and a healthy population. A strong and vibrant nursing profession results in a well-functioning health system and people's overall health. Learn more at RNAO.ca.